Do you know the moment when alcohol withdrawal symptoms stop being just uncomfortable and turn into a medical emergency? A lot of people think quitting drinking is simply about willpower. But for anyone who drinks heavily or for long periods of time, suddenly stopping can trigger dangerous reactions. Recognizing these signs can literally save a life. Alcohol withdrawal happens because alcohol acts as a depressant on the central nervous system. With frequent use, the brain adapts by pushing back in the opposite direction to keep things balanced. When alcohol is removed abruptly, the brain becomes overstimulated. That overload is what causes symptoms that can be mild, moderate, or extremely severe. The first symptoms usually show up between 6 and 12 hours after the last drink. Tremors, anxiety, heavy sweating, nausea, irritability, and trouble sleeping are common and generally manageable. But there's a point where these symptoms stop being just uncomfortable and become a real threat. The first sign of a medical emergency is seizures, which can appear between 24 and 48 hours after the last drink. Seizures mean the withdrawal is severe and they require immediate medical care. The second critical sign is delirium tremens, which typically develops between 24 and 72 hours. This condition brings intense confusion, severe agitation, fever, hallucinations, and dangerous changes in blood pressure and heart rate. Delirium tremens is a true medical emergency and can be fatal without the right treatment. Other warning signs include persistent rapid heartbeat, high blood pressure, high fever, extreme sweating, and sudden shifts in behavior. These symptoms show that the body is highly unstable, and they should never be ignored. Some factors increase the risk of severe withdrawal: heavy long-term alcohol use, a history of seizures or delirium tremens, using other depressant substances, malnutrition, and underlying health conditions. For anyone with these risk factors, quitting alcohol without guidance can be extremely dangerous. In short, not all withdrawal becomes an emergency. But seizures, delirium, hallucinations, high fever, severe agitation, and cardiovascular instability are signs that require immediate medical attention. Being able to recognize these symptoms is essential for anyone trying to cut back or stop drinking. If you want to reduce your alcohol consumption safely, there is a method that teaches you how to do that in just 7 days, in a progressive, structured way and without unnecessary risks. Click the first pinned comment to access the material. Leave a like and subscribe to the channel so you can keep receiving content that helps you take back control of your life without an extra sip.